Okay, so this is the third video for the hematologic system. We are continuing on slide 143, talking about thrombocythemia. Basically, we're talking about alterations to the function of platelets. You can see very simple ideas here. Obviously, platelets have a central role in the healing process, especially the bleeding process, where they adhere to the area and kind of stick to the inner membrane, inner layer, to kind of close the area and where there's bleeding. Uh, of course, there's a normal count of them and there's an abnormal count, and that can change uh, blood tissue content. And obviously, we're looking at two kinds of problems, or perhaps three: too many platelets, not enough, and then also the inability to stick uh, to the sides of the vessel and function as they should. So you see that when we have an increased count, we're talking about at least above 400,000 per millimeter, um, not squared, but in the third degree. And then we may have a primary or secondary reason to it. And you can see that people are usually asymptomatic until the count exceeds 1 million per millimeter in the third degree. Of course, hemorrhage, thrombosis are usual outcomes of problems with platelets because you're not sticking to the injured area and you're not allowing healing, so you have bleeding. Or because of the increased count, they uh, they stick together, and now you have that plaque that is just the thrombosis that is just circulating in the system, and that's a very bad and very dangerous situation. If we go to ET, you see that it's due to increased platelet production to a count of 600,000 and more. Um, you can see an increased count of bone marrow megakaryocytes, um, periodical hemorrhages, and thrombosis. Um, it can be secondary to an imbalance of plasma protein production, and it can be because of defects in cell or membrane receptors. Um, Talking about secondary thrombocythemia on slide 149, you see that can often occur after surgery to the spleen, which develops gradually afterwards. It can be also provoked by inflammation, exercise, and of course, cancer. Uh, the problem in this case is that platelets that are supposed to enter the spleen and die do not. They stay in the circulation, and that is a bad idea. Then they might cause pro-inflammatory cytokines to react um, and develop further, or worsen the situation. Of course, when it's secondary, you always have to add to this the symptoms of the cause of the situation. So if it's secondary to diabetes, you're going to have symptoms of diabetes on top of all of these symptoms. Um, then we can talk about function to platelets function. In general, you have a normal count, but the function itself is abnormal. Usually, what you're going to see is that in the cascade of reactions, a factor there is absent or non-functional, leading to a non-functional cascade, leading to the platelets not being able to fully function and meet the goal that they're there for. And that will cause any bleeding area to keep bleeding and you're losing blood. Um, Obviously, it can be acquired due to any kind of chemical reaction or inhibition of one of the factors or the lack of one of the factors. One of them, of the major ones, being the effectors being aspirin as the most common drug affecting it. Then we can talk about coagulation disorders, um, causing problems with the actual clotting factors. The most common one or major one in this case is the lack of vitamin K that causes the fibrin clot that is supposed to be stable in order for the healing process to occur. It's unstable and it's influenced by multiple factors in this case, not allowing the full healing process to occur. Um, then you can see impaired hemostasis, um, which is the inability to promote coagulation and stable fibrin clot. Um, and it's most likely connected to liver dysfunction. Once again, the vitamin K as a major factor in this case. It will lead to um, hemostatic dearrangements, to the lack of ability to produce that clot, and to platelets dysfunction. Um, it causes decrease fibrinolytic or fibrinolysis as a process, meaning that you have increased scarring in that area. Um, what else? Then we can talk about consumptive thrombohemorrhagic disorders, which is a group of conditions that consist of any um, pathological findings that includes hemorrhage and thrombosis. Um, these are usually complications of other processes due to other diseases, so it's usually secondary, and it causes a confusion or a problematic ability to diagnose because of the mixture and the combination of multiple symptoms that when a disease has one major symptom or mechanism, it's easier to diagnose, whereas here you have hemorrhage and you have scarring, you have thrombosis, so that definitely makes it harder to differentiate. um, and then you have DIC, that you can see is an acquired clinical syndrome characterized by widespread activation of coagulation that leads to fibrin clot formation throughout the body. Notice the phrase throughout the body, meaning that it's spreading. You are talking about the blood stream and tissue, so it can reach multiple places. Um, it can be caused by occlusion of blood vessels and flow to organs, um, that will result in multiple organ failure, and multiple organ failure is life-threatening. Um, it will lead to severe bleeding, which makes things even worse, and you can understand how this will very fast lead to death. So that's all we have for the hematologic system. Um, Obviously, when you tap into the bloodstream, to the blood tissue, when you have alterations to blood, um, you are tapping into the very heart, so to speak, center, and most center principle of existence. Um, Open to every tissue that is supplied by blood, exactly like we spoke about infections. You're going to feel it everywhere and very, very fast. So remember that. So these can be life-threatening conditions, especially in the more progressive and severe conditions of them. As usual, if you have any questions, let me know.